the actual video from like last week. I didn't get to watch like what you guys actually.
That was kind of clunky. It kept getting. It was weird, man. I don't know what happened, but
it's all good.
I did figure out that it is there. It's just it was weird how it yeah. Well, yeah. I'll make sure to get those uploaded today. It's been a little bit of a weird couple weeks.
I've been the same way.
There's been a lot going on with me too. I'm dealing with some other crap too. So
yeah.
Good things are starting to settle down.
Yeah, I know. I'm like, all right, let's just get back to normal stuff again. It's funny. It just ebbs and flows, man. Life. That's life.
right.
Okay. So here we go. Cool. All right, so we started diving into the origin insertion sites. Oh, you weren't here that last week. That's why this.
That's why, yeah.
Well, it's cool. We actually talked about it. We're gonna go over the muscles again.
Okay.
Because there's so many.
I mean, yeah. So I've tried, like I said, it's easier when you get the video because just looking at the paper for me, it doesn't stick. So if having like the talk about it.
Yeah, exactly. Yeah. So let's see. We can go over. Yeah, we might as well. I mean, just plow through this one time real quick here, just because there's so many origin insertion sites. So let's hit this. So what's this thing called?
Scapula.
Yep, and then this is the
humerus.
Yep, and then this is the
clavicle.
Yep, and then this is the
Sternum.
This is the sternum.
That's the sternum. That's the crap.
Manubrium.
Manubrium. Yep. What is this joint?
The clavicular.
Called the SC joint.
Yeah. Okay.
And then
the sternoclavicular.
Yep. And then this is the
AC joint.
Yep. Which is the
acromion.
Yep.
Clavicular.
Yep. Acromion clavicular joint. Yep. And then that's good there. Okay, so then we're talking about scapulas here. Get off. Oh. Oh, that's right. Oh, I forgot that whole thing doesn't come off. That's okay. Okay, so what is this?
The superior angle. The inferior angle. That's a lateral?
Sorry, he's upside down, or he's.
I'm trying to look at it. So that's the medial border.
Yep. Thanks. Okay, and then we have the
subscapular.
This is the.
That's the inside. So that's
Yep. It's gonna be
This is
the infraspinous.
Yep, and then this is. Yep, and then this is the. Yep, and then this is the.
Infraglenoid tubercle.
Yep, and then this is the.
Supraglenoid.
Yep, and then this is the.
Superior notch.
Yep. Superior notch, is that what it's called?
I think so, yeah.
Superior notch, nice man. And then this is the.
Paracoid process.
Yep. And then this is the.
Glenoid fossa.
Yep, perfect man.
Cavity, glenoid cavity.
Is it cavity or
I
fossa?
think it's cavity.
You're right. Okay, infraglenoid tubercle, lateral border. Oh yeah, we heard this guy here.
The lateral border.
Yep. Good. Oh, there we go. Yeah. Okay, cool. Wrong arm. There we go. Okay, so this is. Oh, this is gonna be the wrong one again. That's fine. Okay, so we're
I
gonna.
think I can do it without.
Yeah. Oh, you want to just bang it out?
I could.
Okay.
The head.
Yep. And then this is the.
Lesser tubercle.
Yep. This is the.
Greater tubercle.
Yep. This is the.
Greater tubercular ridge.
Yep.
Lesser tubercular ridge. Intertubercular ridge.
Groove. Yep. Nice. We have the
Deltoid tuberosity.
right here. Yep. And then we have the. Let me see if I missed anything up top here. Boom, 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 boom. That's it.
That
Oh,
should be
yeah. We got head of the humerus here. Did we already say that? Yeah. Cool. And then we have going down. We have the.
Okay, so let's see. This is the trophy, huh?
And then this is the.
Oh wait.
Yep.
Oh wait. I'm looking at the wrong side. Okay, no, then that's the capitulum trophy.
Yeah. Wait.
Wait.
No. You had it.
You were right the first
Oh
time.
yeah. Okay. Yeah.
Yep. Trochlea, capitulum. This is the.
That is the.
I guess
supra. I know. It's epicondyle.
Is that the cornoid fossa?
The
cornoid fossa is over here.
This is the radial
fossa.
fossa.
Yeah.
Cornoid fossa. Then we have the Yep.
And then the medial epicondyle.
Yep. And then this is the. So epicondyle, and then this is the.
Just the condyle.
Yeah, which is weird. I think it's a poor representation of the picture, but and then we have the.
Lateral epicondyle.
Condyle.
Lateral condyle, and then
Yep.
epicondyle.
And then this guy
Is
here.
that the groove of the radius?
This
Radial
is
groove?
the lateral condylar.
Oh, yeah, lateral.
Oh wait. I'm sorry.
Is that it? Yeah.
No, this is the medial supracondylar ridge.
Right, and the lateral.
Lateral supracondylar ridge. Yep. Okay, cool. And then if we flip it, we have.
Okay, then think of the lecnon fossa.
Yep. And then we have
And
the.
then trochlea.
Yep. Yeah, trochlea here. Yep. And then let's see. This guy here. Yeah.
One of them is the radial groove.
And then this is the.
Is that the groove of the ulnar nerve?
Yep.
Yeah. That's the nerve.
Yep. And then we have the groove of the radial nerve. This is crazy when you're looking at the other way.
Right now, yeah. That's
Right here. Groove for the radial nerve.
Yeah.
Cool.
It's different when it's backwards. Trying to
Yeah, I know, it's weird.
It's just nice to look at the actual skeleton because you kind of like it's easier to visualize. You don't think of so much as like a one side.
Right,
Kinda
exactly.
Like flipping it around.
Yep. Okay, very good. So that's just priming us up for the origin and insertion sites of the muscles. We're just gonna cover the motions really quick here. So, what is this motion here?
Flexion.
Yep.
Shoulder.
Yep. And what plane is that in? Yep. And then over here, see it in the video, maybe. And then we have this motion.
So that's in frontal, right?
Yep.
But that would be
Abduction.
Yep.
okay.
Frontal.
abduction,
Yeah. So we
maybe
could just
that's
call this frontal plane abduction,
frontal plane
and then this
abduction.
would be
Adduction.
frontal plane adduction, and then this would be
Horizontal adduction.
or transverse plane. Either one. Yeah. And then this would be
Abduction.
abduction. Yep. Exactly. This motion is.
So you're squeezing in and
Yep.
out.
And then this motion is.
Extension.
Yep. And what plane?
Sagittal.
Yep. We got this.
When you say medial or internal?
Internal,
What's-
yeah.
When you say what plane?
Technically transverse.
Yeah.
It gets tricky. Like some of these ones, like I mean, this technically, you could call this the frontal plane,
Because
Right,
you're
I see what you're saying.
right?
Okay.
Because it's,
Mm-hmm.
right.
but
Yeah.
it's you know, I mean, that's kind of what we would classify that as. But it gets kind of weird when you're, what plane is this? Right. It's
Right.
like that's like an oblique axis. So yeah. So we have.
Yeah, so internal rotation.
Yep. And then.
Internal rotation.
Yep. And then.
Internal rotation.
And then.
Internal.
Cool. And then we got.
External. External.
Cool.
That hurt.
And external.
Yeah. And then.
External.
Yeah. Cool.
Makes
Okay.
sense.
Then we have.
Elevation. Depression. Protraction. Retraction.
And then. The rotating component, we would call this whole motion upward rotation.
Upward rotation.
Because and we're specifically talking about the whole system moving the scapula into an upwardly rotated position. versus just this shruggy motion. You can feel actually if you put your hand on the scapula, maybe on the back of it there.
Oh,
there's that, right? And then there's this.
And that's that when that a couple weeks ago we were talking about that gliding motion.
Scapular rhythm, right? You feel how much different those are? Mike, feel this, man, because it's very, very obvious the difference between. Okay, ready?
Yep.
So there's that.
Okay.
And then there's upward rotation.
Oh, yeah, clearly.
And that's scapular rhythm, right? So this is upward rotation,
right,
and downward rotation. Yeah. This is elevation, depression. You feel how much different those motions are?
Yeah. You kind of can't really do downward rotation except for when you start at this position.
Correct. 100%. Yeah. Unless you're like, but that's depression, right? Yeah. So yeah, I think that's kind of a mentionable thing is like tying in the scapula, getting out of the way of the out of the humerus's way to allow it to get up is when we kind of classify it as upward rotation.
Okay.
Yeah. Downward rotation.
Okay.
Cool. Sweet, man. So deltoid. Here we go. Oh, dude, I just got a new charger cord. I was just thinking about this the other day. I was like, this is going to be the best charger cord for origin and insertion sites.
Deltoid action?
Yeah. That coffee is just freaking
gone already.
Dude, it's gnarly. I have an AeroPress. You know what that is?
Is it like a French press?
It is, but it's like it looks like a syringe, like a big fat. It's weird, but like I had it and I was using it for a while and I like stopped drinking caffeine. I just like put it away. And then one of my clients was talking about her AeroPress yesterday. I was like, I'm gonna try the AeroPress because I'm back on the caffeine again.
Yeah.
And I like put some espresso in there, and I was like, "Oh no, this is fire!" Yeah, no, I'm just like, I need to chill out, man. Okay, so deltoid. So the triangular-shaped deltoid is located on the cap of the shoulder, right there.
Lateral 1/3 of the of the.
Yep.
Of the clavicle.
Yep. And
the cranium, and then the scapula.
Killer.
Superior angle.
No, not this. Is this superior angle?
I think so. Oh, I think it was like this, like kind of like triangle area. Oh, maybe no.
Pretty sure
maybe just
it's
this.
spine. Yeah. So lateral 1/3 of the clavicle, and then also on the spine of the scapula. Yeah. Nice.
The chromium, and then also the spine.
Yep. Exactly.
I knew there's like three kind of things.
Yep.
It's the same. It's the same as the trapezius. Like the trapezius. Like
Kind of similar insertion sites. Yeah, exactly. It's just going to be the difference is going to be on the spine of the scapula. It's going to be more superior versus the delt is going to be more on the inferior aspect there. Yep. Let's see. The origin of the deltoid, which is interestingly enough identical to the insertion of the trapezius, curves around the spine of the scapula and clavicle, forming a V shape. From this broad origin, the fibers converge down the arm to attach to the deltoid tuberosity. The deltoid fibers can be divided into three segments: the anterior, middle, and posterior fibers. All three groups abduct the arm, but the anterior fibers and posterior fibers are agonists in both. I'm not going there again.
Did you ever look up on that whole shenanigans?
I was mulling it all day.
Yeah.
That day, but yeah, it's upon further review, I do see myself in conversation with clients talking about agonists or what were we? Synergists. Yeah. So I do talk about that with clients, and I was like, okay, I get it. I'm withdrawing my argument about that because there is primary movers. It's just that. Anyway, yeah. Like TFL internally rotates the hip and flexes and abducts it. That's its most mechanically leveraged position. So the rec fem isn't going to do the internal rotation and the abduction. So anyway, yeah. Yes. Yep. The deltoid fibers can be divided in. Okay, so there we go. And extension, medial, and lateral rotation. So we have here, 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 and we have there. So abduction. You can see that middle delt isn't doing a lot of rotation, but this guy is going to externally rotate. Yep.
Posterior fiber is external.
Yep. And then the anterior fiber is going to. Yeah. So they're all going to do this kind of stuff here. That's going to be a bias of anterior delt. This is going to be a bias of post delt. This kind of stuff right there. Yep.
Makes sense. Okay.
Yep. Okay, so all fibers abduct, anterior fibers flex, medially rotate, horizontally adduct, posterior fibers extend, laterally rotate, and some of things to test.
That's fine.
I mean, the foot is like, I mean, it was complex.
The foot was complex,
but like,
but
dude,
yeah.
this thing has the most degrees of freedom out of anything. And this will kind of glom in a bunch of other tissue, but I mean, this delt has so many different test positions.
Yeah. Okay.
Whoever wants to hop on, we can go for it.
Sure, I'll go first.
Did somebody call me?
On my shoulders.
Are you filming, bro?
Did someone call?
I don't know. I put it on Do Not Disturb. Hello? It's still, okay.
Yeah.
Last time, remember, it doesn't every time someone calls and it
I
still
know.
records.
It still records? Okay, that's fine. Okay, so lay on your back. We can just start there. So one thing, and this is, when assessing range of motion, this is a super important thing to keep in mind. We have to monitor the scapula as we're checking on the glenohumeral joint's range of motion. So the idea here is with the glenohumeral joint going into abduction or flexion, we want to monitor the AC joint to make sure that it isn't doing the motion that we would expect the glenohumeral joint to do. What I mean by that is sometimes you'll see somebody with like a frozen-ish shoulder and they'll be like, how did I do? How's that look? And you're like, you're not moving your arm. You're moving your scapula.
Here.
Right. So when you do an assessment here, what I like to do is kind of cup and cradle, and then I'll put my hand here to monitor, and then I'll say, hey, slide your arm out to the side. Boom. There it is, right? And then comp pattern would be this. How's that?
Yeah. Okay. Yeah. Going up first.
Versus that, right?
Then out. Okay.
Yeah. And we might be able to see that.
Because you're looking for the abduction, not
correct.
elevation.
Yep. And what we expect to see is like about 90 degrees.
Okay.
That's kind of like normalized range of motion there. Same thing going up overhead. Go up, straight up. That's great, right there. And then once we get there, you can feel that scap starts rolling, right? So that's now not glenohumeral motion, it's shoulder overhead flexion.
Yeah.
Because there's a combination of scapula and glenohumeral joint in this rhythm that's getting you up overhead. So those are kind of the ways to look at that. You can also look at this here.
Right.
Go out to the side, monitoring. Cool. That feels a little more sticky.
It is, yeah.
Yeah, right? So that's interesting, right? Bent elbow, less sticky, straight elbow, more sticky, which means there could be an elbow extension issue, not a glenohumeral abduction issue. Right, that's what yeah, exactly. I would start looking into that going, okay, like what's going on here? Can you stay down here versus can you stay here?
Yeah.
Can you hold it out here? Can you hold it out here? That feels way softer.
It feels better too.
Yeah,
I feel
right.
it like it gets tight
Yeah.
in here when
So yeah, it might be
straight.
elbow extension, GH extension issue potentially. So with the delt testing, we can do this delt testing in, just to simplify it, 2 different configurations: bent arm, straight arm. This is going to give us a longer lever. This is going to give us more mechanical advantage. This is going to be less mechanical advantage. Also, we have to take into consideration the stuff that crosses the elbow axis, bicep, all the bicep stuff. And then this would be us taking into consideration more of the tricep, the elbow extending stuff. So, very simple test position here. To just maintain this position. I'm thinking my line of force is this way. And this would be the the best way to do it here. I feel, because I feel really comfortable with how I test, I can do it all over the place. But right here, maintain this position, ready, go. There it is. How'd that feel?
Feel alright, just a little,
like
it's a little tight.
Yeah, and then try this, maintain this, yep, ready, go.
And I see that, like you said, that's more bicep. You know what I mean?
You
got my bicep in there.
Interesting. Okay.
Like I'm trying to stay stiff through my shoulder right here.
Yep.
But when you do it, my bicep wants to kick in. Yeah.
Relax it. Relax it. Relax it. Yeah. Push this way. Ready. Go. Yeah.
Oh, that's better.
Yeah. Yeah. Nice. And then we can go same thing up here. Maintain this position. Ready. Go. So that's gonna be.
That felt no good.
No good.
Yeah. That felt
sorry.
Yeah. No, I mean it didn't hurt. It just felt
not great.
Yeah.
And then same here. Ready. Go. So we can look at stuff there, and then we can look at biasing this anterior tissue. Ready, go. Right, and we can work on biasing the posterior tissue. Ready, go. You don't like that. So those are kind of the ways you can think about configurationally testing. And then this is the thing, you can test. Stay here, ready, go. Stay here, ready, go. I mean, we can test this stuff, ready, go.
Just from all
over the place.
So now he's kind of pulling away from
Yeah.
And now it's just anterior part of the.
So that's kind of, just thinking about how that joint's moving and what tissue's crossing what axis and how we're testing, what we're testing. That's kind of, those are some of the ways to do that. When we get into pec and into the tricep stuff, we'll get into more testing here. But you want to try a couple of those?
Sure.
Do you want to feel that too?
Do you want to feel too?
Yeah. Or actually, if you do it on me, then you can say that's good.
Yeah, and I can give you some feels too. Yeah. Let me yard on you just to make sure that it feels similar to what he's doing. Go out to the side. So come back in, out to the side. So it gets a little sticky at the top there, huh?
Yeah, about.
Yeah, right there-ish, yeah. And then let's try that.
Walls are kind of sticky.
Yeah, a little sticky up there too. And then we'll go here, and then straight up overhead. That feels less sticky to me. Yeah, sure. Okay. Yeah, then we'll go out here, push here, ready, go. Good. How'd that feel? Cool. And then this would be like more of a post-delt bias, ready, go. All right, and then this would be more of like an anterior delt bias, ready, go. Ready,
so when you just have his arm out here at the 90, is that like more like full delt? And then you get back here a little
more post delt. Yeah, and the way I'm lining up the fibers.
Okay.
So I'm lining up this stuff back here, and I'm pushing more. Ready, go. You feel that on the back side of the arm a little bit? Yeah, so it's more of this like oblique-y angle.
At that 90, it's more.
Yeah, so it's more middle delt tissue.
Yeah, I see what you're saying.
And I mean, this is the crazy thing. You can do bias middle delt, external, internal rotation. You can bias anterior delt, internal, external rotation. Like this is the fun thing about this stuff is you can explore the heck out of this, these systems here. Then we got this, ready, go. And then we got this. Ready, go. Ready, go. That feels a little soft there, or like a little squishy, yeah. And then, these positions here, push here, ready, go. Push out into my hand, ready, go. Yeah, there you go. And so you can check this stuff all over the place, ready, go. Ready, yeah, so you get the idea. Yeah, so do the range of motion assessment first.
All right. Just go ahead, bring your elbow out. Okay, I see what you mean.
You feel how it kind of gets sticky towards the
up here at the top.
Right?
Yeah.
Yep.
I'm just trying to feel it a couple times, just kind of. Now do it with your elevating your shoulder. Bring your shoulder first. Okay, yeah. I just wanted to feel what that felt like. You know what I mean?
And most of the time, what you'll see is they get out to 45 degrees, and then they'll start doing that. They'll be like.
Okay, they'll come out first.
Yeah, you usually don't see that happening because that motor pattern.
So you'll see here.
And then exactly, yep, yeah, because their brain's going. This is how I bring my arm out to the side, right? And then
Bring it out. Let's do it. 5 feet right there, huh? There you go. And through this whole like range of motion assessment, you keep your arm on the AC joint just
Most
to
of the
feel.
time, yeah.
Or
Unless
your
I'm
hand.
doing something crazy, but yeah, I pretty much I'm staying there. Unless I want both joint systems to be working. Like if I want him to be.
Yeah.
Yeah.
Keep it here. Oh.
And just be careful with how hard you push him there. Right, it's kind of a response to what they're doing,
What
not
they're doing,
yeah.
right.
You don't want to be the
Bring it straight.
antagonizer here.
Here. Ready. Go.
Because if they don't have control, it's going to be a delayed reaction anyway. They're going to be like, I don't know what I'm doing. Especially, I mean, this joint is,
Go. Feels good though. It feels
yeah. How does it feel?
solid.
Yeah,
I
can you
mean,
do that one again?
I'm trying to do what I'm biasing back here.
Yeah.
Keep your arm here. Ready. Go.
And
You want me to do it?
can you try? Yeah, I just want to see.
Yep. Ready, go. Ready, go.
Yeah, you're kind of a little bit on the underside, right?
Yeah, I'm a little more back
Yeah.
here.
Was I more? to the
Yeah,
more?
you're like that.
Yeah, so like I kind of put this right there ish.
Like, does that feel better?
Yeah, maybe not. Yeah, not that.
Yeah, yep.
Alright, I'll go in there. Ready. Go.
Yeah.
That felt better.
And you can test it in multiple ways too. Like you can test it like this too. Ready, go. Right, you can test it here. Ready, go. Oh, sorry, push down. Ready, go. You can test that. You can test this. Right, I mean, you can. It's not one way, but you just have to be aware of the lines
Where-
of force.
lines of force
yeah,
of where you're doing
yeah,
it.
you got it.
Okay.
Yeah.
Alright, let's try this one. Bring your arm up. Hold it here. Ready. Go. Felt a little
Yeah.
loose.
Yep. Cool.
What else? I mean, we've got bias in.
So that's gonna be packed. We'll go
That'll
there.
be packed.
Yeah, we'll play with that stuff in a second.
Cool. Yeah, I mean, it
Sweet.
feels good.
Yep.
You want to feel it on me a little more? Or?
I can do it on.
Yeah. Well, yeah, you guys both go a little bit. Whatever y'all want to do.
I'm gonna bend your elbow here. Just bring it out.
So that's yeah. So that's you passively moving me there.
That feels like as far as you want to
That's
go.
it. Yeah. So as soon as I get here, this is why you want to be really careful about passively moving somebody or expecting.
Them to be able to do farther more
Yeah.
than you.
Yeah. Because right here, past here, that's what I want to do.
Right, okay. So,
Yep. So.
okay, then let's straighten your elbow.
It actually feels a little better for me.
Mm-hmm. Yeah, definitely. I mean, you got more
Yep.
range. Okay. That's nice. And then let's go bring it up into. Okay. Does that feel better? Or is it still-
It's a little weird there, yeah.
And then let's see here. What else? Any other range of motion ones that you-
Yeah, we could. Well, yeah. I mean, the internal extra. We'll look at this when we look at more of the rotary stuff. But yeah.
Well, let's bring it out to as far. So then, when you're testing, do you bring it out to like 90, or do you leave where they?
That's the option you get to you get to make, or the choice you get to make. So like for with MAT, what we would do is we would always take people into passive range. That's a high risk thing to do with people. What I typically do, at least in the beginning, is go, hey, bring your arm out to the side. All right, cool. Like, let's check it there, see if you got it even there, because there's no point if they can't even get out there.
Right.
You know, if that's my shoulder doing that, there's no point in even testing that thing. So,
Right. Okay.
Yep.
Okay. So hold it there.
Yep.
Ready. Go.
Nice. Yep. Yeah, and I think a little more push towards the hip.
Okay.
Trying to like close your arm.
Yeah.
Type thing.
Yeah.
And then you do something else like this, right?
Yeah.
Ready. Go.
Yeah.
Strong shoulder, dude.
Let's straighten your arm. Okay. Ready. Go.
Yeah. Feels great.
Let's do overhead. Ready. Go.
Nice. Solid hand placement. You felt that difference,
Yeah.
where you were up on the wrist
Yeah.
and you were like, oh,
Yeah.
yep, yeah, that's it. Yeah, because if you do
Yeah,
a test
then
on
you-
That's like that's.
yeah, that's
Because can you do that? You could.
you
do that, though?
absolutely right. Yeah, absolutely, and
When
we
you're
could.
biasing
We can play with that stuff. Actually, we should probably play with that because, like, we did that with the foot and toes too.
Right.
It's like with Trevor, I exposed something in his body where his arm was a brick overhead, but as soon as I tested it through his fingertips, it was much.
Couldn't hold it at all.
Nothing.
But that has to do with like wrist and like stuff too, or.
Well, his fingers and wrists were strong.
Oh.
So his shoulder was weak when we tested his fingers and wrists.
And
But his
there's that
shoulder.
connection.
Yeah. Right. So that's a synergy. That's basically neural stuff. His brain's going, yeah, I don't do things through my fingers in this position. Total trip.
I can already. I feel like I would be just. I'm already like just thinking that.
Yeah.
I'm like,
You might be surprised, man.
Yeah, but
So, and then if you want to do some like side testy stuff just to play around with that.
So let's see what we did.
That already feels better.
just like hitting it. a little.
Yeah. Just priming it up.
So we kind of done some internal rotation with the vent.
There we go. Yep.
And then kind of like
Yep.
here, ready, go.
Yeah.
About right.
Yeah. Felt good.
I like that. Okay.
And then what? So I came up and over, and you're like, "That's the pec."
Pec.
Where were you getting to get to the inside
Right
of your
here.
shoulder? Right here.
Yep.
And we're pushing
Yep.
down.
Yep.
Okay.
Yep.
About right
Yeah.
there.
So it'd be like here. So I might do that more with my other hand, and I'd get like here.
Okay.
Yep.
Ready, go.
It's almost just kind of pull.
Yeah. Let me hop up and check that on you guys real quick. Just gotta see how I do that. Oh, it is my left hand.
Okay.
So I'm here, ready to go. Ready to go. Ready to go.
So right
Yeah.
there. Ready, go.
This feel pretty similar, Mike?
Yeah.
Cool. You're kind of line of force.
Yeah, exactly. Yep.
Yeah. I feel it. Like you get kind of get your.
Yeah, try and get on that
Yeah.
bony
Yeah.
surface. Yeah, because if we're on the meat, that's the thing. When you're on meat, ready to go. There's like a delay.
Right.
Right.
There's
Like,
like a cushion or
Yeah, the
sponge.
meat squishes, we squish in, and it's like, who's
It's
doing
slip
what?
around.
You
Yeah.
get that
You're
solid
like,
surface.
oh,
you're
I'm
there
here,
already.
ready to go. Boom. We're
Yeah.
there.
Yeah.
You know what
See,
you're doing.
yeah,
Yep.
even for like the patient, like it's
Oh, huge. I mean,
it
that's
feels better for me when
it's
push on the
huge,
solid.
because your brain knows what we're asking it to do.
Right.
You want to try that?
Sure. Sure.
Alright, so.
Yep.
here,
Yep.
Ready, go.
That feels. Yep.
Ready, go.
Yep. Yeah. That.
You've got very good shoulder.
Thanks. So that test feels really, really solid though. Like my brain is like, I know exactly what I'm doing there.
See,
So
but like you say, I've been trying to like focus on like being easier and easier. But like when someone with when I see someone like
Yeah.
younger like you guys, I
Yeah.
know you're a little more healthier. It makes me want to go
no.
super hard.
That's. I mean, what happens? It's like hop down again. I mean, like that. That's kind of. This is the thing. I always go into this with the expectation that I don't know what's gonna happen, right? I don't have any, like, they're not gonna ragdoll me. I'm not gonna just I go into it like, all right, let's see what happens. Ready, go. All right, cool.
Yeah.
Right, and what we're the point of this stuff is we're not testing strength. We're testing control. Right, so it's like, can the brain? I love how Greg says it. The guy that created this program. He said it's like a twitch. I'm looking to see if the brain can twitch on, like pick on. So yep, I got that. So like when you see something like that, we're like, ready, go. And you're like, whoa, okay, sorry, that's good. You got that.
You got that right. Like
Keep moving, right? Versus something. Let me show you another situation here. Versus something where you will see this kind of stuff too, though, right? Like for me, do that test one more time. Like there's that, right?
Yeah.
Then do it again.
Now they're getting all.
Whoa!
Yeah.
What are you
doing, dude?
Hold on. So that's the difference between somebody trying to get into it and like fight because there's something that's wrong there, versus that simple, big. Yeah, I'm there. I'm not
You're
thinking
using
about
what you're
anything.
supposed to.
Right? Versus me.
Dig it. Yeah.
Right? You know, like getting all. Yeah.
Okay.
So that when you see stuff like that, then you go, okay, this person's. There's some dysfunction
something
going on
going
there.
on.
Yeah. And then you go, hey, let's. You tell them, hey, I'm not pushing very hard. Like, you don't have to push very hard. Let's just check to see if you have control.
Right.
You want to nip that in the bud real fast. Because
Real
I,
quick.
like, in the beginning stages of doing this stuff with people, like these CrossFit guys, we'd be playing these, like, compensation wars where, like, they'd be like, and I'm like, oh,
No,
fuck.
I am strong.
Yeah, and I'm, like, trying to, like, show them that isn't strong. by pushing harder versus going, hey, I'm not pushing very hard.
Yeah.
You don't have to push very hard. So that's that idea.
That makes sense.
Yeah.
I like that. That's cool.
Yeah, you don't want to get down that rabbit hole because that can get pretty crazy. Okay, so then we have the what are we going for? The trapezius. The trap lies specifically along the upper back of the neck. Its broad, thin fibers blanket the shoulder, attaching to the occiput, the bone at the base of the head, lateral clavicle, scapula, and spinous process of the thoracic vertebrae. Trapezius fibers can be divided into 3 groups: upper, middle, and lower. The upper and lower fibers are agonists in elevation and depression of the scapula, respectively. All fibers of trapezius are easy to palpate. So, the mentionables about the what's that?
Just saying, it's such a big slab.
Yeah, it is a big slab. The mentionables about the trapezius are specifically that it does connect to the head. So we have to understand that the trap can impact head functionality in the mechanics of the head and neck. Bilaterally, it will extend the neck and head.
Is that both at like is that cervical and
Capital, yeah, because it runs into the occiput.
So it's
Yep.
yeah.
So it does the whole thing. Yeah, head and neck. Unilaterally, it'll lateral flex. It'll rotate to the opposite side. So if the right contracts only, it's going to go left. The head and neck are going to go left. Unilaterally, it elevates the scapula. Upwardly rotates the scapula. Middle fibers abduct the scapula. Lower fibers depress the scapula and help with upward rotation as well. Origin, external occipital protuberance. So, right here, right here.
That's crazy. See, until today, I never realized I'm rubbing my trapezius right here, man.
Yeah.
And because I get a lot of migraine pain right here.
Yeah.
I didn't realize I'm rubbing my trap.
Yeah. Yeah, so that's when people are like, my neck hurts. I'm like, well, is it your neck? Or is it your shoulder stuff that attaches to your neck, right? Because like this, you know, they're the same, but it can be different. Like, is it spinal erector muscles that hurt?
Right.
Is it in your occiput? Is it the big slab there? So, you know, there's so much going on there. Yeah. Medial portion of the superior nuchal line of the occiput. So this is the nuchal line here.
Okay. Yeah.
Like that middle part?
Yep.
Okay, the nuchal line.
You want to feel that?
Right there.
Yeah, it's chalk and muscle there.
Yeah, okay.
This one's not as good as this one is right here. This one's more chalky over here. Yeah, there's the nuchal line there. Yeah, you feel like you can like almost roll over it a little bit there. Yep. And then the ligamentum nuchae. Oh, there we go. And that's excuse me. Yeah, medial portion of the superior nuchal line, ligamentum nuchae, and spinous process C7. That's what I meant. Sorry, ligamentum. And then lateral 1/3 of clavicle, acromion, spinous scap. Yeah. So you guys want to feel some scapular testing?
Yeah.
Okay, let's do it, man. I hope this is recording right now.
Yeah, this is some good stuff.
Yeah, I know. Well, because this stuff's so complex. Let's go ahead, head this way actually. Let's start on your back, but yeah, we are going to go on this stuff. And also with some of that post-delt stuff, we can test that prone as well. I mean, you can test any of this stuff in all configurations. So the way that I'm assessing scapular motion, I look at it with elevation, shrug up to the ear. So there's that. Some comp patterns that I see a ton. I'll see somebody smash their elbow in and try and shrug up, like using.
That's super uncomfortable.
People do that. I'm like,
crazy.
that is the craziest thing I've ever seen, right? So we just want the shoulder. Yeah, that's it right there, up and down like that. So that's how we're assessing upward rotation, which is a heavy trap bias there, upper trap. The way that we can test this stuff is one, by going, okay, is your arm stable? Ready, go. Actually, I'll start you out here. Shrug up to your ear. Stay here. Ready, go. Right, so that's a trap test. Go again. You can go here too. Ready, go. Ready, go. So what I'm seeing here, go again. Ready, go. Is he's got some anchoring issue going on. Try this side.
Almost in like I feel like I'm anchoring my ass.
Yeah. Go here. Ready, go. Yeah, and that feels like a brick. Go again. Ready, go.
Yeah, that feels good.
Ready, go.
I'm gonna tell you, this is. I mean, I do have more issues with this shoulder
Right.
than
So there might be something there. So that's the safest way to test the trappy shoulder upward rotation
I almost
stuff.
feel like I was almost digging in my left side.
Yeah, I'd be curious.
I'm trying not to, but I almost feel like that I was, you know, when
Try
you do.
packing your ribs here and then shrug up. Ready, go. How'd that feel?
It feels better.
Yeah, a little better. Nice. So I mean, that's the thing is, we have to be aware that rib cage, core, trunk, spine, all this stuff can impact. Yeah, there's a lot of ribby stuff, huh?
Yeah, it's
It's
like
crazy
seeing it
how
over
much
and over
it.
again.
Yep. So that's a safe way to do it. Then we can look at it here. So if their arm is stable, and we're feeling like we want to tease out higher risk, higher loaded testing positions in the shoulder, then what we can do is go bring arm out, shrug up, shrug, shrug, shrug. You okay there?
Yeah.
So now I have a longer lever and I'm testing multi-joint motion here. Stay here, ready, go.
See.
Don't feel that bad.
Didn't feel bad, but
Right?
I did feel 100%.
Great, right? Yeah. Go again. Shrug, shrug, ready, go. It doesn't feel bad to me.
It feels a little better.
Better that time, right? So that's kind of this upward rotation-y thing. You
Like
can test
reaching for the
that.
top shelf.
Yep. You can test that in
really
multiple configurations. You can do it this way. Shrug, 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 shrug. Stay here. Ready, go. Good.
So that's with external rotation.
And shrug, 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 shrug. Ready, go.
I don't like
He
that.
doesn't like that, right? So that, those are different. And you would think about how the scapula works there. That's gonna
You're almost elevated.
tilt, externally rotate,
Okay, yeah,
right?
yeah, yeah.
It's gonna put it into different positions there. We also have this kind of stuff. Stay back here, ready, go. There's that, right? There's this, ready, go. There's this, ready, go.
Shoulder
There's
smooth.
this. Yeah, let's do the other side.
Yeah.
There's this. Pull the shoulder blade back. Rest. So you can test it like this too. Yep, and then go out to the side. So this would kind of be middle trappy, rhomboidy, retracty stuff. Ready, go.
All right.
Good.
Yeah.
Pull that shoulder back. Ready, go. That's getting into more like latty, rhomboidy stuff down there. But yeah. But and then we can go up here. We can go here. Pull the shoulder back. Ready, go. Ready, go. Right. So, I mean, there's so.
I can feel it
You right. You can
right
feel
here,
what's
like right over my
Yep.
scap when you're doing it.
So it's
like
kind of
when I bring
latty,
my-
maybe
yeah.
a little bit middle lower trap. So just, dude, this is the thing. It's endless.
Right.
This system is endless. But those are just some ideas of ways that we can test the scapula. And then if you flip on your stomach,
It's crazy.
you want a face cradle.
No.
Yeah,
Sure,
we get
why
it.
not?
Yeah, let's just do it.
I like how it's got it on both sides of this.
I know.
Makes it so easy.
Yeah, I'm gonna get these same tables for you guys too.
Yeah.
Well, yeah, we'll all have the same. There's one. Somebody will get that one for now at least, but so then you can go like here, and then now you can feel this prone, right? Pull your shoulder blade, not shruggy, but up, 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 up. Now, oh boy, ready, go. Now we're testing the big stuff there, right? Now you can feel, ready, go. Right, and then there's here, reach your arm forward, and shrug, 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 ready, go. There's that, reach up, 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 stay up here, ready, go. Ready, go, stay up here, ready, go.
Shit, man. It doesn't
Right,
like that.
yeah, so there's so much stuff we can do back there too.
Yeah.
Yep, so,
Wow.
yep, you wanna feel that stuff
Yeah.
too? Okay.
Do you want to swap it out?
Yeah, that's what I'm thinking, then you guys can
Feels
kind of,
good, yeah.
then you can both
sense.
feel it, and then we can all yard on each other.
Yeah.
So this is the upward rotation shrug, just the shoulder going up to the ear.
Oh, right.
There's that right there. There we go again. And then that's the other thing you'll see sometimes is people going like,
Reaching their ears.
right, which means they might not have stabilizers on the other side stabilizing their neck. So that's something to think about too.
Oh,
Like
okay.
if you see like this thing, it's like, oh, why can't you stabilize here?
Oh, because you're holding.
Right.
Okay.
Yeah, we need that other side to
crazy.
keep
Yeah,
the
yeah,
neck. So yeah, because what that means is that this trap
It's like,
is
like
pulling
pulling
the
you
head
down.
over too.
Instead.
So then we might have a dysfunctional trap on the other side.
Okay.
And it's very possible if that might be the case. And then we have, oh yeah, I'll give you that feeling of shrug. And then stay here, ready, go. So there's that, ready, go. A little switchy there, try this side, ready, go. Ready, go. That feels better. Which side was it, the ribs? Pack your left ribs. Go here, shrug. Ready, go. Yeah, there it is.
I looked way better too.
Yeah.
Or you can tell.
And then we have the abduction. And we'll check the abduction first. Come back down a little bit. So stay here. Ready, go. Is that okay? Shrug up, shrug, and then go with the arm. You okay there?
Yeah.
Stay here. Ready, go. Yeah. So no go there. Rest. Yeah.
That's a weird feeling.
Shrug. Good. Ready, go. Better. How'd that feel?
Yeah, better.
Go
I
again.
think I just was like,
Yep. Shrug. Ready, go. Better, right? So
Yeah.
so your body's just figuring it out. It's fine. This is what
so
we.
you do the shrug for, you don't go up and then shrug.
You have options. You have options. Yeah, you can set it either way. Excuse me. Yeah. You can go with the arm. Reach.
Go up with the arm.
Reach. Different motion though, right? Shrug. Reach. Right. Then you get there. We're getting the rotation. So I would only shrug up, shrug, and then reach.
Show
So you
something
see
to
I'm
show.
stopping here
Yeah.
because I'm testing elevation, whereas that's upward rotation, right? So that's a very good point to differentiate those two things,
Yeah.
because that's the scapular rhythm test. Because it's really it's hard to test. Like I was doing. This is a way that you can test upward rotation, but
Upward rotation.
yeah. Oh, excuse me, elevation. Thank you. Yeah, but you don't have a ton of mechanical advantage, right? You're not going to be able to put a
Very
lot of
small space.
yeah.
Right.
So you have to push really hard because you're trying, you're trying to put 5 pounds into it, but it's like their whole body is this like silo, Whereas here you can kind of get out there and get some good testing in. So this is overhead here, and then so this would be definitely upward rotation, not elevation stuff here. Stay here, ready, go. Very nice, and then you can even test this. Reach, stay here, ready, go.
And that's one idea.
Right, so that's an elevation-y and upward rotation-y thing. That's like capped out, getting the scap up, end range trap position. Then we have those other positions here. Retract, pull back, and then come down. Stay here, ready, go. Good, and then here, ready, go. Good, and then and then we got up there, and then you can go here, ready, go.
Ooh.
You okay there?
Yeah.
Yeah. And then we can do this rotation in. Shrug. Ready, go. And then we can go here. Roll. Ready, go. And so there's just so much stuff you can look at there.
Yeah.
And it's all biasing different stuff, right? And you can think about it in muscle terms, or you can think about it in just joint position, joint movement terms, which is now in my brain what I pretty much do only is like, I'm like, okay, like shrug up, stay here, ready, go. Okay, can they do that externally rotated? Ready, go. Can they do that closed out with external rotation? Can they do that closed out with internal rotation? Can they do that with a flexed position? Can they do that in an, this is another one, right? Shrug, ready, go. Ready, go. So that's biasing more clavicle. You don't have any of that, right?
Yeah.
So you're way more stable in this extended abducted position than you are in this flexed adducted position. And so then what I'm thinking is, okay, we're biasing more of this anterior clavicular stuff, like whatever attaches here, like this front side trap, front side delt, sternocleidomastoid, all this stuff that runs here that gets the scapula or the clavicle moving. So
Okay.
it's a lot, man. You just gotta play with it
is.
when people.
Crap ton.
How'd that feel? Good.
Yeah.
Cool.
Do you want to try it on me, Mike?
Sure.
And then once he tries that on you, we'll flip you and we'll go posterior.
So let's just shrug up. Shrug up. Hold it there. Ready, go. Relax. Try to shrug up one more time.
Let me get some eggs. I'll be right back.
Hold it there. Ready, go. Yeah, feels good. Then we had so just shrug up, come out. He's stopping like there, right? Because then when we get here, that's almost rotation.
Yeah.
Okay. Alright, let's shrug up and come out. Alright, hold that there. Ready, go.
Yeah, you probably go a lot lighter.
Lot lighter?
Yeah.
Okay. Shrug up, hold that there. Ready, go.
Yeah.
I see it.
Yeah.
Okay, I see it now. I'm gonna let you, like, I need to,
Yeah.
you come to me.
Mhm.
Alright, come up one more time. Hold it there. Ready, go.
Yeah.
Okay.
Nice.
Felt that. Yeah, because it's like, it's when you're way out there.
Especially it feels like such a bad position. Like, ooh, you could get hurt.
Right. Yeah, 100%.
Let's see what else you do.
We had, I think he up and then rotate.
I guess we did the rotate, yeah.
Yeah. Hold that there. Ready, go. Okay, feels good. We can do the annual rotation. We don't need to do that though.
Yeah.
Let's bring it.
Did you do any up above?
He did up above. Oh, that's what he did. Shoulder back. Bring your shoulder back down into the bed and come out. Hold that there. Ready, go. Feels good. And what he did, reach all the way up, and all the way up, and shrug. Give it up. Shrug. Was that one of these?
I think so, yeah.
Hold it there. Ready, go. How'd that feel?
No, amazing.
Go.
Like on myself.
Yeah, that's what I'm saying. Felt a little squishy.
Yeah.
That's what I was asking.
What was that?
Then
The
he
one
had-
that I did that was really bad for me. I guess was
Was that a externally rotate?
what was the one that felt really bad? It was
Was the
I did when I biased that
Oh.
clavicle.
so it was a
That stuff.
external.
All that. Ready, go. Oh, no, other way. Ready, go.
Yeah.
And then ready,
Are you
go.
pulling him? Or
Yeah.
you're
I'm passively
this way.
setting him. Yeah. So, I mean, I'm just taking you into all sorts of crazy places. Like, I would probably, if this was a client of mine, I'd say, hey, can you shrug bring your, yeah. Ready, go. Still not great, right? Good, again, shrug up, shrug, and then bring your arm this way. Ready, go. Right, I was being a little aggressive just because
Alright, bring her.
I was trying to be quick.
Hold it there. Ready, go.
And you're going this way.
I'm going this way.
Mm-hmm.
Oh, okay, that's where I was.
Yep.
That's what I was trying to ask. I was
Oh, I'm
confused
sorry.
where your force was going? Because you were just so nonchalant right there.
Yeah,
I'm like,
I know.
Which way's your
My
force
bad,
going,
dude.
Jazz?
Yeah, so it's like,
All right. Sorry. Hold. Try to push me. Ready, go.
pull.
I'm pulling.
Yeah. Sorry. So you're pushing towards me here.
I'm pushing towards you. He's
Shit, you're pulling. You're. Who am I talking to?
I haven't even doing
He's going towards me. You're going towards you.
Okay.
Yeah.
There you go.
all right. Hold that position. Ready.
Sorry, I was talking to him, dude.
I was confused. All right, you're good.
I mean, it's weird for me. I was like, what am I doing? I was confused.
Right. Yeah. So you wouldn't want to be.
Do you want to try this side, Jazz? Because this
Yeah.
seemed to be okay, and I was like, what?
See, yeah, a few positions.
Ready. Yeah. Ready. Go. Yeah, it's way different.
That feels
Ready.
better.
Go.
And even like on these
Not
ones.
perfect.
No, not great. Ready. Go. It's way better though.
And now with
Ready,
internal
go.
rotation.
Ready. Go. Did it feel better when he was testing you?
Yeah, but I think it was doing something slightly different.
Yeah.
I didn't do it in chest this one
Yeah,
internal.
I
I
think
did
you were
have
more
one
like
internal.
here.
Oh,
Yeah.
gotcha. Ready. Go. That's more bicep.
Yeah.
That's more bicep.
Ready. Go. Yeah. So you shrug.
So you gotta get
Shrug that way. Ready. Go.
now that shoulder.
Yeah.
Okay.
Yeah.
Yeah.
I wasn't shrugging.
Okay, that's where we
Yeah.
were messing up.
I'll try
Okay.
it one more time, Mike, on this
Yeah.
side.
Yeah.
Shrug.
All right, reach your arm up and shrug your shoulder to your ear.
Yeah,
That
for
position.
sure. That's
Ready, go. Okay, yeah, I feel it.
that looked better though. Did that feel better?
It seemed a little better, yeah.
It's getting there, but I mean,
Oh, again, that looked way better. Ready, go. Are we pulling different directions? Ready, go.
I was pulling from.
Oh, your lever's longer. Ready, go. He's comping somewhere.
Right, yeah,
Straighten that elbow. Ready, go. Yeah,
Yeah.
he's bending his elbow. So yeah, your body's smart, right? It's like, let me get a little.
Yeah.
So you're
Get a little bend in it.
Yeah.
Now you got bicep in there.
and a lot of those internal rotators.
Right. Okay.
Versus getting that straight lever, and then so that straight lever, we're getting the test more through the collarbone, that AC joint.
Okay.
Because it's crazy. Like, this is the crazy thing. If we're thinking about it, we're not testing this.
Right.
We're testing
That and
this.
Yeah, all this stuff. Right.
This right here.
Oh, just this little.
Yeah, this
that
joint right here. And I'm thinking, ready, go. I'm pulling against. I'm trying to move this joint.
Yeah.
This way.
Right. Okay.
It's crazy to think about that.
Okay.
So you could feel that too. Like, if you wanted to on somebody, you could be like, curl, 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 shrug into my fingers here. Cool. Do it again. Shrug into my finger here. Yeah, cool. Ready, go. Right?
Yeah.
So you can feel that with, I mean, put your finger on the collarbone there.
Where was it? Right here. Yeah. All right. Shrug in my shoulder. Okay, so it's like you're feeling it to kick on right there.
Yep. Yeah, you can feel the collarbone almost
Right
pinches
there.
into
Yeah,
the
yeah,
finger.
yeah.
Right?
All right, hold that. Ready, go. Yeah, I feel what you're saying.
Mhm.
And it literally, it almost can grab your. It almost
Yeah.
like grabs.
It can almost pinch into the finger there.
Okay,
Yep.
cool.
Prone? You want to feel some prone stuff there? Yep. Okay, so we're going to go out to the side with this arm. You okay there? Okay, and then I'm going to have you shrug up. Shrug backwards. Yeah. And then bring this arm out to the side. Does that feel okay there, or is that vulnerable?
It's okay.
Okay, I'm not going to push very hard. Stay up here. Ready, go.
Yeah, you can see
So,
how much kicks on.
Yeah, and Mike, I mean, this is a good thing to see here. Like, when we came out to the side like this, I said, pull back here, pull back into my hand here. As soon as I see weird stuff going on here, I'm like, dude, bring your arm out. Like, I'm like, hey, I'm not going to do much here. Just see if you can hold it. Ready, go. And I'm barely, I mean, he's got nothing there.
Yeah.
Right, so I'm being really cautious. As soon as you see the body start going like, uh-oh,
Tense up
you
when you
can
get
feel
to-
it.
yeah,
Yeah, right?
yeah.
I can, like, feel
And
it.
that's why you gotta touch them. You
Always
gotta feel
hands
them.
on, like, I can feel his whole body going, oh no. Bring your arm this way a little more. You okay there? Keep going. Keep going. You okay there? Shrug back this way. Back, 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 back. Straighten that elbow. Stay here.
Because he doesn't like his arm straight when he's doing this.
Ready, go. Yeah. So, and that's, I mean, you can see on the front side, I was feeling way more careful, or way more comfortable, like, moving him just because I didn't feel that, like, check engine light.
Right.
Here, I'm like, no way. I'm not going to mess with this thing. He's super vulnerable. I'm letting him do everything.
Yeah.
Bring your arm this way. This way. Keep going, keep going, keep going. You okay? Shrug back this way and up, 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 up. Ready, go. Yeah, okay. Ready. You want to try again? Ready, go.
You're going down with your force.
You want to try one more?
Sure.
Ready, go. Yeah. So if we straighten that elbow, it would have been mush.
Bend over.
Mush.
And you're letting him get to that natural position that he wants.
Yeah, I'm just like not pushing the envelope.
We'll bring this arm out. Alright, shrug it up, shrug back.
Which position should I be with my hand?
You can. Good morning.
Is this right?
You can choose, but what I'd like to start with is palm down.
Palm down.
Because it's kind of neutral with the scapula.
I kind of like it. I get that.
Right, and then if you wanted to get into some crazy positions, I mean, you could be testing that stuff there, but
So bring it out. Shrug back in my hand. Bring your arm up. I feel what you mean. He doesn't want to go any further.
Right.
Than
yep.
that. Okay.
And then yeah, you can test, the full abduction, frontal
Right.
plane. You can test abduction horizontal. You can test anywhere in between. So, yeah,
Okay.
cool.
Yeah, I felt like it was just like my sounds like this.
He was like, no way. Yeah,
It's
this doesn't even exist there.
like
See, that one
super
felt
hard.
pretty good on me when I was back.
Yeah,
when I could
yeah,
use
I
more of
agree.
my muscle, but
Yep, I agree. Okay, so we can do the assessment first.
we'll just shrug up. Okay, shrug up. Hold it there.
Yep.
Ready, go.
And I'd go a little bit thinking about pushing.
Almost like that. Then.
Yeah, like let me get your hand. Let's see. I would go. Yeah, and I would get that elbow down, right there. And get on the pad. Yep. Yep.
Check out.
Yep.
Hold that. Ready, go.
Yeah, there you go.
Okay, well, that did feel
Yep.
a lot better
Yep.
with our pressure now.
Ready, go.
Yep.
Then what do we have? We have
How's that feel?
Great.
Okay.
Lit it up.
Like great, great, great.
Felt the trap.
then what do we have? We had
So now it's
bring your arm,
shrugging and
bring
straighten
your
out.
arm out.
Yep.
Shrug
Yeah, so
up.
I would
Shrug
first. I would also check the GH first, just to make sure it's reliable.
Okay.
So you could test it down here, and then you would be pushing. Yeah, exactly.
All right, hold your arm here. Ready, go.
Yeah, so that's all day.
That felt
Feels
good.
fine. Yep.
Yeah. And so now we're
Yep.
here. Shrug. Bring your shrug your shoulder to your ear.
And I would and what I would do is always come back down. Always have your hand on the moving into side,
So right, like this.
but don't pull them, right? So
Right.
hop on really quick. Because this is when you start like assaulting the nervous system. Come this way. See how I'm just going
You're
with
just
you?
there. Yeah.
Check this out versus this. Here we go.
Yeah. Okay.
Right, that's
Or even
bringing
like, I think I was doing this at one point.
like a grab and pull.
Yeah.
Yeah. You wanna kind of
Ride.
yeah. Come with me.
Yeah.
Come unless you want to move them passively. Then relax. See, that's why I don't even like passively testing anymore.
It's weird.
It feels horrible, right?
Yeah.
Yeah, it's like,
Like
your
you're-
system is like, I'm scared.
Stop making me do
yeah,
that.
Exactly.
Yeah.
All right. No, that makes sense. Stupid MATs.
All right.
Passively testing people. All
So
right.
you're just asking. So.
Yep. See how
Get in a
much.
different position though.
Yeah.
How are you wording this to us though? You're saying bring your arm out.
You go shrug,
shrug,
and then
shrug.
arm, and then I'm there, right? So
Mhm.
this
Right
is
there.
testing upward or the elevation versus reach.
And then Now you're texting rotation.
Yeah. Yep.
All right. Cool.
Yep.
So bring your.
So-
I'm trying to figure out the best way to stand.
I think you. Yeah. You can play with it.
I don't even know
You can
yet.
play with it, man. Yeah. See what works.
I almost feel like here, so
That's
I can
cool.
feel.
Yeah, I like that. I do that all the time.
Shrug. Arm up. All right, cool there.
Yep.
Hold it there. But then
Yeah,
now
now
my
you're
force is
pulling.
weird. But now I'm like
Yep.
pulling. But,
Yep. Which is okay.
All right, hold it there. Ready? Go. Full. Solid.
Yeah. And then you can try from the other side too. Yeah.
Oh, I see.
Just to see how it feels. But
Yep.
then it's
Yep.
hand. Ready? Go. It feels good. I feel almost better pulling.
Yeah.
So it's
But-
Fine.
shrug and hand up. Resist, ready, go. A little
A
pop.
little pumpy.
Okay.
And then we can try. Yep.
Okay, shrug. Keep it there, ready, go.
Cool. Yep. And then we have the upward rotation as well. So the reach.
All the way up,
Yep.
yeah.
And you can test reach at any position too,
Mm.
right? I mean, that's the thing to keep in mind is like, if you want to test it here, you can test it there.
Mhm.
If they want to go with you and test
They
it
can
up
get-
here,
they can get all
here,
the way up.
yeah,
Mm.
you know, so
Okay.
somebody go for it.
Yeah.
Yeah.
And then reach, ready, go.
Nothing.
Yeah. Yeah. Okay.
Yeah.
I'm gonna try this side. Just
Yep.
reach all the way up. Reach. Shrug. All right. Hold it there. Ready. Go. Am I testing? I'm testing that way, right?
So what did that feel like? It had more than
Or
this
am I-
side?
Yeah, big
This side
time.
looked like
This
nothing.
felt solid. That
Yeah.
felt really good. And was
And
I
be-
testing right though?
Yes, just
Okay.
be like I said. Be careful with this stuff, right? Because
Yeah,
you're.
yeah.
I mean, you're
Ready,
getting up.
Go.
Yeah. I'm looking for them to do. I mean, this is pretty vulnerable
Yeah, it's really
positions
dynamic.
here.
Yeah.
Go. So wait for you almost.
Yeah,
Just kinda-
yeah, and make sure your line of force is real locked in.
Is it that? So this.
So here we are, and you're testing this way. Yep, maybe a little less distracty. Yeah, that.
Okay.
Yep, that's it right there.
Okay.
Ready, go.
Yeah, that's money.
Okay.
Try that again, Mike.
You got like a downward.
Are you? Yeah, what's going on there?
I'm trying to pull out.
Think
I think you're
about
kind of going
pulling
down.
this way. Yep. Is that's still a little.
Ready, go.
It might be where he's standing too. I don't know if that's part of it.
Because I mean, I'm pulling this way.
Yeah.
there, ready, go.
That feels different.
What if I do? Ready, go.
That feels different.
From what I did before, first time?
No.
Then just
From-
my
Mike.
mic.
Yeah. Is it hand placement?
Do you
Maybe
want
try
to
going a
switch with
little
me so you
lower.
do you want him to do it on me so you can see what's going on?
Yeah. It might be where your hand is, Mike. It might. Maybe it's that it was on the wrist.
Where do you want it?
Or maybe, yeah. At the fingers.
Here.
Yeah, yeah.
Ready, go. Ready, go.
Ready, go.
I can see what's going on.
Ready,
Here. Straighten your fingers. Straighten your fingers all the way.
ready, go. Does that feel better? Work better?
Let me check.
I don't feel like I'm doing anything different.
Yeah, ready.
I'm
go.
doing it.
Your wrist is flexed though.
How does that feel?
That's what position Josh just put me in.
Yeah, it feels like you're going.
Yeah.
Do it
Yours
again.
isn't
Ready,
flexed.
go. Ready, go.
Yeah, I guess maybe it's.
Ready, go. Okay. Go for it, Mike.
Ready, go.
Oh, it's subtle.
Ready, go.
That feels better.
Ready, go. Ready, go.
Yeah, that felt. Try having him do it on you now.
Okay. Did they start feeling more similar?
Yeah.
Arm up, show again. Up there, ready, go.
Yeah. I don't know what is different about that.
Go.
I don't know what's different about that.
I think it seemed like it was for.
When I got my hand here, I can almost feel a little better. Force.
There we
Now,
go.
I feel
Like a teeter-totter
Yeah,
or
yeah,
like
I
a
had to
push
get
pull. There we go.
even.
I think
Yeah,
you were
it's
slightly like this, and before Mike was going like that.
Got you. Okay.
Kind of felt.
Okay, cool. Yeah. That's
It
good.
feels better.
Nice. And then we can go here.
Straight, just straight up.
Yep.
Hold it there, ready, go.
Yep.
How'd that feel?
And
Too,
then-
too much
Yeah.
force or?
Okay. Keep it there, ready. Oh wait. Yeah, keep it there, ready, go.
that felt good. Yeah, try it again.
Hold it there, ready, go.
Yeah.
Didn't feel as much. Right, hold it, ready, go.
This just feels weaker over there.
Yeah,
I think
yeah,
that
yeah.
you want to
That's
feel
what
this
it
side
is.
too. Yeah, I don't think you were putting too much force in. I just think I didn't have it there.
Ready, go. Oh,
Yeah, it's yeah. That's another tricky thing too,
Right,
right?
yeah.
Like if you're, are you like, am I pushing
Is it me
too
or the them?
hard?
Yeah.
Yeah, exactly. That's why it's always good. Like if you're going, what's going on over here? Go check the other
check the
side.
other side.
And you're like, oh, okay,
Okay,
sorry,
yeah.
you're hella strong over there. This is definitely something that's breaking down
That
on
makes
this
sense.
side.
Yeah, totally.
Yeah.
Then
I'm gonna
we
go test
got-
this guy.
Hold it there, ready, go.
It's fine.
Fine.
Yeah.
What's that with that kind of internal?
Internal.
That was the
Yeah.
internal rotation.
Ready. I'm trying to get a weird position. Ready, go.
Yeah, that didn't feel good.
Yeah.
And then we got this guy.
Okay. How would you do this? I guess maybe like this.
Yep,
Ready,
that's
go.
And are you bringing
Is
your
that-
shoulder back in? You up.
Kinda that,
More
yeah.
Can you do
rotation.
that the internal rotation one again from here? So this didn't feel good to you. Ready, go.
Yeah, that don't feel good.
Oh yeah.
Yeah, it's getting worse actually.
Yeah.
And then we got this guy.
Hold it there.
Yep.
Ready, go.
Yep. And then I'm sorry.
Maybe. There, ready, go.
Yeah, those both feel good. Yeah.
Cool.
It's this left side is solid compared to.
In like some position, and then there's
Yeah.
this is another one.
We could do that one with us.
I think I
Hold
did.
it there, ready. Oh yeah, no.
Wait, this
Oh.
way.
This
yeah,
one.
yeah, yeah.
This one.
Oh.
Alright. Ready. Go.
Think about more up to the ceiling. Yep.
Like this.
Yeah, that works.
Ready. Go. Okay.
Yep.
You're
a
saying
weird
up
one.
to the
You
ceiling.
may have done this one.
Ready, go.
Yeah, I don't have it there.
Yeah. That was weird. Okay, ready, go.
I don't have it. You want to feel this side, Mike?
Ready. Go. Oh yeah, no.
Yeah, not
Not at
actually.
all.
Yep.
So
I feel
what's
that
what you're
side.
testing right in that?
It's like trappy, like middle lower trappy, post delt, like infraspinatus stuff. Yeah, posterior, more posterior, lower.
Like serratus?
Um,
Sub? No.
maybe a little serratus. This is gonna get you like more serratus-y stuff here.
Okay, but you're.
This is gonna get you more like trappy,
Okay.
yeah, like middle lower trappy stuff there.
Yeah, good.
Yep. Yep. And Mike, those feel pretty good. The one thing I would say is just be careful about like counter levering on the scapula.
Yeah.
Like just make sure you're not like doing a push pull,
Right.
but just feel like you can even like right when you test like let off of the scapula. Yep.
Okay.
So this one we had, you bring in your arm
Yep.
and you're holding it here.
Yep.
Ready, go.
It's hard.
Yeah, that did seem
All right,
hard.
bring this one up. And that's as far as you want to go up. Huh?
Yeah.
That's fine. Hold it there. Ready. Go.
Yeah,
Oops, sorry.
No, you're fine.
interesting.
Yeah,
Three,
there we
You
go.
want me to just take myself into position?
Yeah,
You
I'm
guys
trying
can
to.
go?
I'm just trying to.
Yeah, yeah.
remember,
So we got this. I don't even know where I'm at. There's that 90.
Yeah,
Yeah.
ready, go.
And then make sure you're not on the hand.
Right.
Yeah.
Ready, go.
Yeah, I err on. I mean, unless you want to test the hand,
Right.
but like even if you have, like, even if you're not
Right,
pushing
just a
on the
little
hand,
bit, yeah.
it changes
Yeah,
the way
yeah.
the brain's
Gotcha.
interpreting that information. Go here again, Mike.
Ready. Go.
Like I feel like you're on.
Oh,
my
it was on your
hand.
hand there that time. You're right. Ready. Go. Yeah. It's almost like you're anchoring down there too. a
Yeah,
little bit.
and I really try when I'm here. Somebody hop on real quick. How you doing? Oh, you gotta leave in 5.
Yeah.
Okay.
I actually
Alright.
posted it a little earlier today.
Okay. Oh, come out to the side here. So like I'm erring on the side of caution and trying to be like below the styloid here.
Gotcha.
Like you can feel the difference here, Mike. Ready, go.
Right.
Ready,
Versus-
go.
Yeah.
Ready, go. Right.
Okay, so I can do this hand. You're like here. Ready, go. Versus that.
That feels good. Yeah, because I mean, when
Yeah.
you get anywhere at the wrist.
Yeah,
you
you're
might-
like I need to.
Yeah,
Right.
you're nowhere near the wrist.
Yeah.
The wrist is like,
Yeah, you don't want to. And the same thing downstream here, like with the with the heel. If you're testing a hip, ready, lift up. Straight leg, sorry, lift up. Ready, go. There's that, which is just like what's going on versus here. Ready, go.
right.
Yeah.
Right. So you don't want to confuse. Or if you're like I'm going to push through your heel, or you don't have to say it, but say lift up. Ready, go.
Knowing that you're pushing.
Like that's. He knows that's what's going on there. Yeah.
Rather than like on the keel.
Yeah.
Like,
And then the brain's like, what's going on?
yeah.
Yeah, I gotta get going.
Dude, awesome.
Yeah. So not Thursday, but let's keep in track.
Yeah, this weekend we can cover some stuff and get some stuff rolling and yeah.
Yeah.
Yeah,
Okay.
let me just kind of figure out what ends up playing
Yeah.
out this weekend and we'll go from there. So
No problem at all.
cool. All right.
Yeah,
This shoulder. Oh, we'll go for it.
I was like today later. I think I'll be done at 4:30. So by the time I get here, it might not be worth it.
Yeah.
So, but
Yeah.
just-
Yeah. If we'll just keep in touch, man. Also, that client is ready to rock and roll.
Cool.
So we'll figure out. Yeah, I reached out to her yesterday. I'll have a better idea.
Perfect.
Yeah. Cool, man.
Good.
All right, brother. Yep. Have a good one.
See ya.
Bye.
We're good on that.